So friends, today we are going to discuss investigations in heart failure. Initial evaluation in heart failure should include routine blood investigations like CBC and KFT. Second, ECG. ECG helps to detect underlying ischemia, arrhythmia, infarction and conduction abnormalities. Therefore, it helps not only in diagnosis but also in guiding treatment. Third, chest X-ray. Important X-ray findings in a heart failure patient may include first, cardiomegaly, increase in cardiothoracic ratio more than 50% in PA view. Second, Batwing sign, which is basically due to accumulation of fluid in alveoli. It is bilateral perihilar. Third, antler sign, in which upper lobe veins become more prominent than the lower lobe veins. It is due to pulmonary venous congestion and increased left atrial pressure. Fourth, curly V lines. It is short horizontal lines at the basis of the lung. It is due to interstitial fluid accumulation. Fifth, peribronchial cuffing due to pulmonary congestion. Sixth, pleural effusion, usually bilateral or right-sided, which is manifested by blunting of costophrenic angles. Fourth, echocardiography. Echocardiography remains the gold standard investigation for diagnosis and assessment of patient of heart failure. It not only helps in classification of heart failure on the basis of ejection fraction into systolic and diastolic heart failure, but it will also give information regarding the cause of heart failure. We can detect regional wall motion abnormality, valvular heart diseases, structural heart diseases on the basis of echocardiography. Not only that, it will also help in guiding therapy. Then, fifth, anti-proBNP. Anti-proBNP is a hormone released by the heart when the ventricles are stretched. It not only indicates diagnosis but also severity, prognosis and response to treatment. Values more than 450 pg per ml in patients less than 50 years of age and values more than 900 pg per ml in patients between 50 to 75 years of age makes diagnosis of heart failure likely. Lower values makes the diagnosis of heart failure unlikely. Higher the level of anti-proBNP correlates with more severe LV dysfunction and severe left ventricular failure symptoms. Elevated anti-proBNP level correlate with increased risk of hospitalization, adverse event and increased mortality. It can also assist in response to treatment. Changes over time reflects improvement or worsening. It can assist in decisions regarding escalation or de-escalation of therapy. For example, usage of certain medication like ACE inhibitors or diuretics.